Our next speaker is Ken Maxwell. So you can come up here as I'm introducing him. And he has a really powerful story to share. He's a veteran who lives in Asheville. And he's been through a lot, including an undiagnosed traumatic brain injury that resulted in 415 consecutive days of cluster headaches. And if you don't know what a cluster headache is, they're known as suicide headaches due to their intensity. And that's more than a year, I just want to point out. So thanks to Psilocybin Clinical Trials at Yale, Ken found a glimmer of hope and is now an advocate for psychedelics as a treatment for cluster headaches and has been featured in a book called Psychedelic Outlaws. So a big, warm welcome to Ken Maxwell.
I'm a little short right now. Thank you very much, and I'd like to thank Vanna for her assistance today. As you can see, I'm an arm short, so I appreciate her her arm as assistance. But I also want to begin by saying what an incredible asset we have in the Pearl Institute and their family. Their mission, their research, their experiences, and most of all, their hearts of care and hope for people who suffer are critical not only to Western North Carolina, but to our state and to the nationwide movement to bring safe and intentional healing to many. That includes those suffering from many physical and emotional traumas and conditions. They have been an invaluable asset and partner as we have worked with the state legislature to establish clinical trials to confirm further the efficacy and most effective protocols for the wholeness and health of all of our citizens. While we are not where we need to be just yet, we are hopeful to see progress in the 2025 legislative session. And Jonathan Lebecki and Gina Giorgio, who are here, and so many others that are also here, have been such an integral part of that process, so I thank them as well. My introduction to psychedelics came out of desperation. After my diagnosis of clusters following a traumatic brain injury, I found myself battling the beast with all kinds of medications, injections, experimental treatments, doctors, specialists, and a few Hail Marys that were just not effective. As of today, I've tried more than 35 medications, more than 50 different therapies, 20 different medical professionals in 3 states. At its peak of the beast, I was taking more than 600 pills per month, more than 40 injections per month, and this was just to try to survive. I also had broken 5 teeth and crowns from clenching during the attacks, where the pain is just so overwhelming. I've had 2 teeth pulled and will be getting my first dental implant in the next few weeks, all because of this horrendous disease. At its peak, I was averaging more than 3 attacks per day, which is more than 1,100 attacks over 12 months. In early 2020, I contacted Yale, who was conducting a double-blind study using a psilocybin pulse regimen to treat cluster. I simply wanted a copy of the results, but I ended up becoming the very last subject enrolled in this trial. I completed 2 trials over 6 months apart. That was pivotal in my treatment. It not only gave me hope for the first time in 12 years, but psilocybin eventually broke the 415 consecutive streak of those neurological attacks. I had not experienced one single day in over a year without these horrific suicide headaches. Thanks to psychedelics, my number of attacks in 2023 was reduced by 48% over 2020. And most importantly, the number of severe attacks, what I call the widowmakers, apologies to my wife, was down by 82%. Psychedelics have saved my life, and I became an advocate. This past June, Rutgers sociologist Joanna Kempfer, as mentioned, released a new book called Psychedelic Outlaws. It chronicles the journey of cluster survivors like me and how they became the driving force in citizen science as we continually faced obstacles in the failed healthcare system, pharmaceutical industry, political dysfunction, the power of money, and in some of our research institutions. It's a compelling story of how desperate patients took matters into their own hands and discovered a protocol that saved lives. That protocol was the basis used in the Yale clinical trial that saved my life. Dr. Kempner does a beautiful job telling that story, and she will be coming to Asheville later this year to speak. I'm very grateful for Pearl's support in introducing her to our community. So be on the lookout for details from Pearl as they are finalized. Thank you for your support of Pearl, which is so critical. And please stay engaged as we continue the important work to make psychedelics part of the solution for so many who are suffering. Thank you.
Thank you for watching, and please remember to like this video and to subscribe to our channel.